This video will help educate you about the gastrostomy tube. This is an actual gastrostomy tube. Gastro means stomach and ostomy means opening. You may hear it called a Mickey tube or a G tube. The button your child has looks just like this one. It has a balloon on the inside, just like that. The balloon and 2 stitches on each side of the tube is what will help keep it in the right place. It will heal in about 6 weeks. It is important that this does not fall out during the healing process for the next 6 weeks. Keep the site clean and dry and watch for any signs of redness, irritation, or infection. The signs for infection are redness, swelling, tender to touch, warm-hot to touch, fever of above 100.5, and drainage at the site. The drainage sometimes can have a bad-smelling odor. You will also see that there will be 2 stitches on each side of the tube with a little bit of glue covering those. Those stitches keep the gastrostomy tube secure and in the stomach. It also helps form the tract for the gastrostomy tube. It is important that the tube doesn't fall out, especially during the first 6 weeks after surgery. If it were to fall out, here is your emergency kit and instructions. You will want to keep this kit with you at all times. If the tube comes out before your child's 6-week appointment with pediatric surgery, you will take this tube and put a little KY jelly on the tip of it. The KY jelly is included in the kit. You will then slip it into the hole gently, about 2 inches. This tube is meant to keep the tract for the gastrostomy tube from closing. You should not feed anything through this temporary tube. At that point, you will call us, as this is just a temporary fix. Proper cleaning around the site is imperative. It is very important that you wash your hands before you start. Bacteria that causes infections often lives on our hands. Take a clean washcloth to the area at least once a day. Wash in a back and forth motion. For the first week, you can use warm water without soap. Do not give your child a bath in a bathtub for the first week. After 1 week, you can give your child a bath and submerge the tube in the water. Clean under the disc or around the tube as well as the outside of the tube and skin surrounding the tube. Pat dry. Take note of any redness. If you notice any redness, you can use a little Desitin cream to protect the area. There are a couple of skin conditions that sometimes can happen around the gastrostomy site. The first one is an infection. The site would be red, warm to the touch, tender to the touch, and a bit swollen. Your child may have a fever, and there may be drainage at the site. This is something that we would want you to notify your pediatric surgery team about. Another skin concern is something called the granulation tissue. This is a moist, red, beefy-looking tissue that will sometimes grow in response to a plastic tube in the body. The tissue produces mucus that can irritate the good skin that lies next to it. Protect the good skin with Desitin cream and notify the pediatric surgery team, as this is something that we will want to treat. You can email our team photos of concerns that you have so we can help determine next steps in your child's care. Next is the extension tubing. This will hook on the button for feedings. You will see a little lip that will lock onto it. Note it is labeled lock and has an arrow showing which direction to turn it. If it appears not to lock, make sure the lip is still there as it sometimes breaks off. If it is broken, use a new extension tubing. It is a good idea to keep additional tubing on hand. These tubes can be used for 1 week at a time. You will wash them regularly and dispose of after 1 week. When the extension tube is hooked in, it is important to tape it on securely as we don't want the button being pulled. This extension tube can be used for anything liquid, including medications. However, nothing thick should be used as it will get clogged. After each medication administration or feeding, you will flush with 5 milliliters of water using the syringe provided. As a reference, 5 milliliters is equal to 1 teaspoon. The extension tube can also be taped to your child so it stays securely in place. You can use any kind of tape that works for your child. If your child is more active and mobile, there is a belt that can be worn to keep it in place. When the button is not in use, the extension tubing should be removed. All equipment must be washed in hot, soapy water after each use. Remove any excess water and wrap in a clean towel. It can be stored in a covered plastic container in a refrigerator as the cold temperature reduces bacteria. We will see your child in 2 weeks and again at 6 weeks. It is important that anyone involved in your child's care attends the 6-week appointment. The gastrostomy tube will be evaluated every 6 months after that. After your child no longer needs the gastrostomy tube, we will deflate the balloon and it will close and heal on its own. If you have any questions, please call the Sanford Children's Specialty Clinic and ask to speak to the pediatric surgery team. We are here to answer any questions or concerns that may arise.